This is a video about ultrasound in the diagnosis of endometriosis, ABCDE. My name is Suzanne Johnson and I'm a gynaecologist from Southampton. Endometriosis is a common gynecological condition affecting around 5% of women. It's defined by the presence of stroma and glands outside of the endometrial cavity, and this is hormonally responsive, leading to cyclical pain, bleeding, inflammation, fibrosis and the formation of adhesions. Endometriosis is a cause of pelvic pain, dysmenorrhea, dyspareunia, dyschezia, subfertility, or it can be asymptomatic. There are three kinds of endometriosis. There is superficial endometriosis, ovarian endometrioma, and deeply infiltrating endometriosis, DIE. And DIE is when endometriotic lesions extend for more than 5 millimeters underneath the peritoneum, surrounded by inflammation and dense fibrosis. It's not certain what causes endometriosis, but there are theories of retrograde menstruation and/or metaplasia. The mean delay between a woman having symptoms and a diagnosis of endometriosis is 8 years. And 1 in 3 women had consulted their GP at least 6 times before referral and diagnosis. The symptoms can overlap with other conditions like irritable bowel syndrome, and it can be diagnosed on ultrasound, MRI and laparoscopy. A pelvic ultrasound, though, is often said to be normal, and patients are told that there is nothing wrong, which leads to long delays in diagnosis. But you need to look for deep infiltrating endometriosis, mobility of frozen pelvis, and site-specific tenderness on ultrasound to make the diagnosis. In 2016, the International Deep Endometriosis Analysis Group published this paper, and it's a consensus opinion on terms, definitions and measurements to diagnose endometriosis on pelvic ultrasound. They have defined this as being useful to do in 4 steps, and these can be done in any order. And the first step is a routine pelvic ultrasound of the uterus and adnexa, looking for signs of adenomyosis and ovarian endometrioma. The second step is looking for soft markers like site-specific tenderness and ovarian mobility. The third step is looking at the sliding sign as mobility in the pouch of Douglas. And lastly, looking for DIE nodules in the anterior and posterior compartments. But you can do these steps in any order. Thank you very much.